Good evening, everyone, and welcome to our Healthy Caribbean Coalition World Obesity Day webinar. I just want to welcome you all on behalf of the Healthy Caribbean Coalition and the Pan American Health Organization. We just want to welcome you and thank you for joining the webinar in commemoration of World Obesity Day. We meet under the theme Caribbean Paediatricians Call to Action on Obesity 5 years later, Demystifying Ultra Processed Products, Policy Wins, and more. For World Obesity Day in 2021, Caribbean Paediatricians signaled the alarm, urging action to address concerns with childhood obesity, overweight and obesity, and mental health. It's been 5 years. What has changed? And what really remains the same? So this wonderful webinar will delve into this and much more. My name is Alex Johnson. I'm a clinical dietitian and a member of Healthy Caribbean Youth, and I am happy to be on today. We will now at this time have our welcome, our opening remarks, and we're going to invite Dr. Karen Seeley, board member of the Healthy Caribbean Coalition, chair Trinidad and Tobago NCD Alliance, and member of the board of trustees for the World Obesity Federation. You see how much title she have? Our thing turn up. So we're going to invite her to come and give some nice greetings this evening.
Good evening, Alex. Thank you very, very much. Good evening, everyone. I'm really very happy to be here. This is, in fact, a very important webinar. I think it is a very timely webinar because the theme for 2026 World Obesity Day, 8 Billion Reasons to Act, reflects the crisis on our hands when it comes to obesity. And this crisis is one where, as we say, half of the world is going to be obese by 2030. The other half is going to be working with them to, in fact, improve their obesity and for them not to become obese. We have this problem many times fold in the Caribbean. We are among the highest prevalence rates for obesity. For adults, 28% in 2015 and 27% in 2025. And today in the Caribbean, 3 million children and teenagers aged 5 to 9 are overweight and obese, ranging from 10.2% of the population to 42.7% in the Bahamas, 10.2 in Haiti, 42.7 in the Bahamas. So this is a situation that we have to not just deal with. We've been trying to deal with it. We have to, in fact, go with it with some acceleration as we go. It is also a timely webinar because just at this time, several of the commitments that the governments have made need to be assessed. And the Caribbean pediatricians have really led the way, as it were, as we go forward in this time. Just to quickly remind ourselves, it's almost 20 years since the historic CARICOM summit that led to the Port of Spain Declaration, which led to the first UN high-level meeting. Caribbean Corporation in Health has a strategic priority, which includes NCDs. Doesn't specifically say obesity, but NCDs. And then, as we hear today, mainly because we have to thank the pediatricians for raising the alarm 5 years ago. We need to focus. We need to, in fact, make some impact on obesity. There's evidence of increasing priority on obesity as we go forward, if only to be measured by how many times the word obesity appears in political declarations, etc. And it's very slow. If you're judging it by that, it's very slow. So we need to work on that to get our countries to make obesity a priority at all levels, nationally and internationally. But there are some policy wins, and that's what we're going to hear about today. I'm looking forward to that because it's the wins you have to, in fact, celebrate and learn from. And the fact that we are all here today, it's because we are going to be able to hear from persons and share who are sharing their experiences, and we are going to be agents to take that forward, to share and ensure that the efforts to remove and reduce and halt obesity, if I could say that, in fact, are going to be eliminated. I'm particularly interested in this demystifying ultra-processed foods and look forward to that particular discussion. Thank you.
Thank you very much, Dr. Karen Seeley. Beautiful, beautiful opening remarks. We now will have Dr. Gloria Giraldo, and she's the advisor for the Non-Communicable Diseases and Mental Health Sub-Regional Program Coordination for the Caribbean and from the Pan-American Health Organization, who is partnering with us at HCC. Dr. Geraldo?
Thank you very much, and good afternoon, colleagues, partners, and champions for the health of the Caribbean. We join a global chorus under the theme of 8 billion reasons to act on obesity. But in our region, we have a specific, urgent set of reasons: our children. Current data from PAHO remind us that nearly 1 in 3 of our children, as Dr. Seeley just mentioned, are overweight or obese. So we know that. And we're no longer talking about a future crisis. We're talking about a current crisis. This is the NCD pipeline starting in our primary schools. And this is not a matter of individual willpower. It is a result of the systems and environments we have built for our children and our youth. As we move through today's webinar, we will all be able to see, as we know, that this is truly about a systems approach. And like the wise adage tells us, it takes a village. From PAHO, we continue to work on the plan of action of prevention of obesity, and from WHO, the acceleration plan to stop obesity, with the strategic lines related to primary health care and promotion of breastfeeding and healthy eating, improvement of school nutrition and physical activity environments, fiscal policies and regulation of food marketing and labeling, and surveillance, research, and evaluation. You will get a lot of those elements today. This multi-sectorial approach, a whole of society approach, requires for us to continue working together. Our ministries of health and education, their leadership is the bedrock of change. In the case of the implementation of school nutrition policies, civil society, like the Healthy Caribbean Coalition and all of its members, this advocacy ensures that the voices of the vulnerable are heard. To our parents, we recognize they're trying their best, making choices in a world where ultra-processed foods are cheaper, easier to get, and we are here to support them so that they can make the health choice. To our healthcare providers, and we need you all as allies in prevention. To our vendors, they are at school canteens, as the street corners, offering our children nourishment, so they are part of the solution as well. We are moving beyond the silos to see the whole child, the whole adolescent. Finally, obesity is a policy outcome, which means if we've had the power to contribute to design it, we have the power to undesign it. We have to continue the regional push for the front of package warning labels, and the policy leadership in this group will make that happen. We have to shift back to our roots of wellness. So let's sit tight for an excellent, invigorating webinar tonight. Thank you very much.
Thank you, Dr. Geraldo. We will now at this time have Latifa Holder, who is my co-moderator and nutrition colleague. Latifa, over to you.
Thank you so much, Alex. Good afternoon, everyone. As Alex said, my name is Latifa Holder, and I am a member of the Healthy Coalition Youth. Before we get further into the webinar, I just want to remind you guys to use the question and answer box. So any questions that you would have, and you could use the chat box to put in any comments. Also, a point to note, this webinar is being recorded and it will be available on our website and on our YouTube channel within the next couple of days. So now we are going to look at the call to action video that was done by the Caribbean Paediatricians in 2021. And while looking at this video, I want you to think about the lives that we lived in 2021 during COVID. I want you to think about the lives particularly of our children what they were eating, what were their physical activity levels were like, and their social behaviors. And we would discuss it after the video. You can put your comments in the chat box. So let's look at the video now.
Now more than ever.
Now more than ever.
Now more than ever.
Now more than ever, our children and our youth need us to step up.
Today, we as pediatricians from around the Caribbean region released an open letter to the people of the Caribbean.
Right now, our region's children and youth are facing a crisis.
COVID-19 pandemic has turned their worlds upside down, and this has affected their physical health and mental well-being dramatically.
Children are moving less during the school day and eating more as a result of an unstructured eating schedule and overconsumption of empty calories.
As a result, we have observed a very concerning increase in weight gain among our patients.
Mental health continues to be a silent crisis, and our patients and children are suffering. Our patients are experiencing anxiety and depression.
Our children and youth need us to step up.
We are calling on public, private, civil society organizations, and parents and guardians
to come together and do their part in helping create healthy environments, right?
Making healthy foods accessible.
creating opportunities and providing resources to stay active despite the lockdown.
And normalizing and destigmatizing mental health.
The situation is urgent.
Now, more than ever, we need to step up.
Our children and youth need us to step up.
Okay, did you all see the video? I'm seeing some comments in the chat with some person saying they were not able to see the video. Please indicate to me in the chat if you saw the video. I'm seeing some comments saying that they, okay, good. All right, so some people saw it. Okay, great. Okay, great. Okay, great. So tell me, what are your thoughts? Have you been able to identify some of the trends that the pediatrician spoke about in the video? Yes, now more than ever, we need to act. Okay, thank you so much. So, what has changed since this call to action video? This was in 2021, and we are now 5 years later. One thing that has definitely shifted is the dialogue that surrounds the ultra-processed foods and products. There has been noticeably more attention in mainstream media alongside a growing body of progressive research highlighting their harms. This shift has been helpful for us as advocates, as it clearly and credibly underscores the associated risk with these products. Most recently, in the Lancet series on ultra-processed foods and human health, marked a significant moment, helping to move the conversation forward and place the issue firmly on the public health agenda. So now we're going to hear from Mrs. Yuri Martinez-Steele, who is going to talk to us about the key findings from this Lancet series and the implications for policy progress. Mrs. Yuri Martinez-Steele is a researcher from the School of Public Health in the University of Brazil. Mrs. Yuri?
Yes, hello, can you hear me?
Yes, we can hear you. Take us away.
Let me just see, unmute. Yeah, I'm going to share my screen. Well, I'm very happy to be here with you today. Thank you for the invitation. And I'm going to share my screen now. Can you see my screen?
Yes, we can see the screen.
Okay. Okay, so I'm going to talk to you about the NOVA classification system, dietary patterns based on ultra-processed foods and health outcomes. As was mentioned previously, in November last year, a Lancet series of 3 papers was launched. The first of which is Ultra-Processed Foods and Human Health, the main thesis and the evidence. The second one is Policies to Halt and Reverse the Rise in Ultra-Processed Food Production, Marketing, and Consumption. And the third one is Towards Unified Global Action on Ultra-Processed Foods, Understanding Commercial Determinants, Countering Corporate Power, and Mobilizing a Public Health Response. Many different groups, researchers across the world were involved in these and were co-authors of these 3 papers. And I'm going to basically focus on the first paper. And this paper discusses, in regards to ultra-processed foods and human health, the main thesis. So the main thesis is that the displacement of traditional dietary patterns by the ultra-processed pattern, both identified by NOVA, is a key driver of the pandemic of diet-related chronic diseases. I'll step back and talk about briefly the NOVA classification framework. This was a classification that was launched in 2009 in NUPENS and the University of Sao Paulo. And basically, this food classification categorizes foods based on the extent and purpose of industrial processing. So we have a first group that's unprocessed or mini-processed foods, that are those foods when they're separated from nature or preserved by processes that largely keep the structure of the original food matrix and do not add salt, sugar, oils, or fat. We have a second group, which are processed culinary ingredients that are substances extracted from group 1 foods, such as, for example, butter, oil, and sugar, or from nature, as the case of salt. And these are used to prepare, cook, and season group 1 foods and traditional dietary patterns. We have a third group, which are processed foods, that are foods manufactured by the food industry simply by taking group 1 foods and adding salt, sugar, oils, or fat, basically to preserve these foods and enhance their sensory properties. And last, we have ultra-processed foods, which are assemblages of processed food substances, which are ingredients we don't find in home cooking, and additives that are engineered and marketed to displace all of their NOVA groups, traditional dietary patterns, and are also engineered to be overconsumed and maximize industry profits. So even though we talk about them as ultra-processed foods, in fact, they're food formulations. How do we identify these ultra-processed foods? So basically, we use markers, which we can find in the list of ingredients. So we have either, we identify ultra-processed foods either because they have food substances for exclusive industrial use, such as, for example, high fructose corn syrup or whey protein concentrate, natural flavors. And there's always, or most of the time, there's a non-ultra processed food equivalent, which would be, for example, this plain yogurt with strawberries. Even though some people have argued that not all ultra-processed foods are equally unhealthy, which nutrient-wise is true, what's true is that basically, as I mentioned before, every ultra-processed foods has a non-ultra-processed equivalent, which is healthier than the ultra-processed version. For example, oats would be healthier than ready-to-eat breakfast cereal. So based on these NOVA thesis that I mentioned before, this implies 3 testable hypotheses. The first one is that the ultra-processed pattern is globally displacing traditional dietary patterns. The second one is that exposure to this ultra-processed pattern deteriorates chronic disease-related diet quality. And the third is that the exposure to this UPF pattern increases the risk of multiple chronic diseases. And first of all, I'd like to say what is a dietary pattern based on ultra-processed foods, okay? It's basically, or studies have used either the calorie contribution or the gram contribution to the overall intake. And this is what we call so based on these proportions, we can categorize intakes in the population as low exposure, medium exposure, high exposure. For example, in the US, for example, people that consume more than 60% of ultra-processed foods would be exposed to a high ultra-processed food consumption. These three hypotheses were first tested and confirmed in Brazil. And you can see these results in these three papers. And since these studies were published, these hypotheses have been tested in multiple countries, multiple settings, and actually the number of publications has risen exponentially. In regards to the ultra-processed pattern is globally displacing traditional dietary patterns, we have evidence from different types of studies. For example, this graph shows time trends and the estimated national dietary share of UPFs across different countries, from Canada, China, across the world, Brazil, Spain, UK, US, Korea. And we can see that the national purchases of ultra-processed foods have increased in all these countries over time. We also have evidence from sales data. These are kilograms per capita. And we see what has been seen is that studying 93 countries according to income, the sales of ultra-processed foods have increased in all these strata of income. And even in high-income countries, even though the sales of sugar-sweetened beverages have decreased, the share of ultra-processed food have increased. In regards to the second hypothesis, remembering that it was the exposure to the ultra-processed pattern deteriorates diet quality, we have, first of all, some studies that have shown that this UPF pattern is associated with multiple nutrient imbalances. We have this systematic review and meta-analysis published by Martini et al. And they showed that based on national dietary intake surveys in 13 countries, that ultra-processed food consumption was directly associated with increased total fat, saturated fat, and added sugar intake, whereas it was inversely associated with fiber, protein, and potassium intake. There's also evidence that the dietary pattern based on ultra-processed foods is associated with increased energy intake. And this has been tested in multiple studies, cross-sectional cohort studies. And we now have 6 intervention studies that help or that get close or can better prove causality. So we have, for example, 2 crossover randomized control trials that were carried out in the US and in Japan. And there were, so people were both exposed to a high and a low UPF intake. One of the arms was 80% of ultra-processed foods, whereas the other one was 0%. And both diets were matched for offered calories and nutrient content. And they saw that over that period of the study, people consumed more calories, 500 calories per day in the US and 1,800 calories per day in Japan during the ultra-processed diet when compared to the non-ultra-processed diet. And they also gained more weight during the ultra-processed diet. This other study, which was also a crossover randomized controlled trial, in which with diets with 80% of UPF versus diets with 0% UPF, and also matching for offered calories and nutrient content, they also observed that an increase in energy intake and body weight and fat mass during the ultra-processed diet when compared to the non-ultra-processed. Then we have this 8-week community intervention targeting UPF reduction among overweight and obese participants. And they saw that over the intervention, people decreased their ultra-processed food intake from 75% to 50% of total calories. And their body weight also decreased in about 3 kilograms over the 8 weeks. This other study, there was an 8-week behavioral control intervention targeting UPF reduction in participants with gingivitis. They also saw that ultra-processed food consumption decreased from 30% to 20%. The total energy intake also decreased by 900 kilocalories per day. And also the full mouth bleeding score decreased by 23%. And we lastly have this sixth intervention study that found that people were exposed to diets with no UPFs and the current UK dietary guidelines, and they saw that during that people reduced their energy intake and body weight. So there's also evidence that increased ultra-processed food consumption is associated with increased exposure to xenobiotics. So we have, for example, some studies, not that many, but some that show that ultra-processed food consumption is associated with increased exposure to acrylamides, to phthalates and bisphenol, and also with certain additives such as artificial sweeteners, emulsifiers, colors, flavors. And in regards to the third hypothesis, that exposure to the ultra-processed pattern increases the risk of multiple chronic diseases. By now, many systematic reviews and umbrella reviews of systematic reviews have been published. And the latest systematic review was published last year in November 2025. And they did a meta-analysis of cohort studies on the exposure of ultra-processed diet and chronic disease outcomes. And they found that 92 out of 104 cohort studies, mostly of good quality, showed an increase in risk of one or more chronic diseases spanning all organ systems. So these meta-analysis confirm associations for 12 out of 15 outcomes with 4 or more studies. So they show that there was association between increased exposure to ultra-processed foods and Crohn's disease, abdominal obesity, dyslipidemia, type 2 diabetes, depression, all all-cause mortality, all cancer mortality, among others. And basically, the association between exposure to the ultra-processed dietary pattern and risk of chronic diseases fulfills all relevant Bradford-Hill criteria for causation. This means in regards to consistency. So studies conducted in different settings in different countries and by different researchers and also using different methods, for example, food frequency questionnaires or 24-hour recalls have shown similar findings. These associations are strong, at least as the magnitude of strength is similar to the protection conferred by the Mediterranean diet. These studies show that these associations, there is a temporality. So because this systematic review meta-analysis I just showed was based on prospective studies in which the exposure precedes the outcome. there's a biological gradient. So in most of these studies, they showed a dose-response association. These associations are plausible. So there are many potential mechanisms that could explain this association. These associations are coherent, so they don't conflict the natural history and biology of the disease, and have been confirmed also in experiments. So basically, this evidence confirmed the three hypotheses regarding UPFs that underlie the main NOVA thesis that the displacement of traditional dietary patterns by the ultra-processed dietary pattern is a key driver of the pandemic of diet-related chronic diseases. And I invite you to read the papers 2 and 3 of the Lancet series, in which they delve on policy and political actions. Thank you.
Thank you so much for that very insightful presentation, Yuri. I definitely enjoyed it. And I think based on the work that has been done in these studies, it is safe to assume that we need to watch and pay attention to our exposure to these ultra-processed foods as well as our dietary patterns. Thank you so much, Yuri.
Thank you.
So we see that there has definitely been some progress over the past 5 years. But what else has moved? Has there been policy progress? Has there been further dialogue around commercial determinants of health? Over the next few presentations, we are going to discuss a few of these topics. And I want you to listen out for commercial determinants of health, conflict of interest language, and policy implementation versus policy adoption. We are going to have Ms. Maisha Hutton, Executive Director of Healthy Caribbean Coalition, as well as Ms. Kaj Archer, Health Education and Promotion Officer from Bahamas, and they are going to take us through the policy wins and progress on the commercial determinants of health. Take it away, Maisha.
Thanks, Latifa, and I'd like to acknowledge that this presentation was developed by Ms. Danielle Walwyn, our Advocacy Officer, and she's unable to present, so I'm jumping in to play this role for her. So policy progress and update. And first of all, we're going to start with the policy progress across the region. And this is a plug for HCC's Childhood Obesity Prevention Scorecard. I'm not sure how many of you are familiar with the scorecard, but it is a consolidated tool which allows you to go on and really see across the region what policies have been implemented in each country, support childhood obesity prevention, and also take a look at the legislative tools where they exist. So with that, let's take a quick look, a snapshot of country progress across the region. So starting with Jamaica. Just recently, many of you may be aware, Jamaica announced a special consumption tax, which applies to non-alcoholic sweetened beverages, cigarettes, and pure alcohol. This was introduced by the Ministry of Finance and Public Service, but with acknowledgement that it had a public health impact and it also had a public health incentive. Jamaica also has a school nutrition policy that was approved by Cabinet on April 7th, 2025. It has a phased implementation. It is being implemented by the Ministry of Education and the Ministry of Health. And this supports the interim beverage guidelines, which were introduced in 2019 and fully implemented in 2023. Shifting to Trinidad and Tobago, and when it comes to school nutrition policies, Trinidad and Tobago is a leader in the region. They were the first country back in 2017 to introduce a ban on SSBs in schools. They have since very recently, this last month, announced an update or a revision to the school nutrition guidelines. And we're really impressed with that move. They're very keen to get going on that. And they also introduced or announced a prioritization of front of package warning labeling. Next, we have Belize. Belize also recently approved a school nutrition policy. It's a comprehensive policy which seeks to, again, address the food environment. It builds on its Ministry of Health SSB ban, which was introduced in 2023. The current school nutrition policy implementation is being led by the Ministry of Education, Science, and Technology. And they've also indicated plans to introduce legislation restricting marketing aimed at children inside of schools, and also measures to protect against conflicts of interest. Moving to Barbados, again, Barbados is one of the kind of front runners of around school and food policies in general. In 2015, they were the 10th country globally to introduce a tax on sugar-sweetened beverages. And recently in 2022, they introduced an increase in that tax to 20%. They've also been leading the way as it relates to school nutrition policies. In 2023, the National School Nutrition Policy was launched, and they are currently in the process of phased implementation. Again, as with other countries, the school nutrition policy is being implemented in partnership with the Ministry of Education and Ministry of Health. And kind of hot off the press in Barbados this week, they announced an 85% compliance with the SB sweetened beverage regulation in the school settings. Antigua and Barbuda also has a health levy, which was approved in 2023 by Cabinet, and we hope that we will see legislation this year in 2026 as part of Healthy Living Push. So commercial determinants of health and what has happened in the past 5 years. So we saw the wins, the policy wins that we've had across the region, but at the same time, we need to acknowledge that there has been policy inertia. And we see that inertia when we look at the kind of policy scorecard that the PAHO and WHO put out, where there's so many reds in terms of policy progress. And so why have we seen some of those policy gaps? And they really relate to kind of the negative dimensions of the commercial determinants of health. And those are the actions of industry actors to really delay, dilute, derail policy development. And so when we have insufficient safeguards in policies making spaces, we get this disruption of the policy process, hence the policy inertia. So HCC has been working with partners across the region over the past few years, 5 years and earlier, to build awareness around commercial determinants of health and to create tools to support responding to conflicts of interest and managing conflicts of interest. We've had a number of sensitization sessions, and most recently in October, we had a regional sensitization session where we pulled together partners and we really kind of took out our pencils and papers and said, how do we work on actual tools, guidance to help member states and CSOs develop the kind of tools they need to respond. I'm really excited that you're going to hear from the Bahamas after me, which is really groundbreaking work on conflict of interest in the Bahamas. We also developed some resources with partners. That first resource you'll see on the left is around public health decision-making in CARICOM, using the labeling standards process as a lens through which to improve and safeguard public health decision-making from conflicts of interest. And we also developed donation guidelines to help to inform what types of food should and should not be accepted during times of disaster. And then we tried to really increase public dialogue, sought to build awareness around issues as it relates to conflict of interest and commercial determinants of health through a number of campaigns, where we've seen many new voices contributing to the public dialogue around commercial determinants of health, including young people. And you can see more about those campaigns on our websites. So final thoughts as we look to the next 5 years and reflecting on progress thus far. We've had notable policy progress. The Caribbean has made important policy advances on the NCD prevention, alongside growing regional conversations on the commercial determinants of health and the need for conflict of interest safeguards. I'd like to point out a key milestone, which was the 2023 Bridgetown Declaration on NCDs and Mental Health. This is a SIDS document, which was very clear around the response to commercial determinants of health, and one of the only documents, political documents globally, which is so strong on commercial determinants of health, a signal that this is a particularly complex problem in our small island developing states and a significant contributor to delays in NCD progress. And also, as I mentioned earlier, the Bahamas Health Promotion and Wellness Act, also really key milestones in this area of commercial determinants of health. And we've also continued to share lessons learned across countries with similar contexts. So as we look towards the next 5 years, what are our priorities? Well, we need to shift towards policy implementation, enforcement, and monitoring and evaluation. This includes strengthening of existing standards, institutionalizing meaningful engagement of civil society and youth so that policies and programs really represent the people, the voices of people on the ground, those with lived experiences, reinforcing conflict of interest protections and developing tools that are tailored to our unique contexts, improving regional knowledge sharing platforms, and ensuring that decisions are grounded in strong evidence. And with that, I want to acknowledge again Danielle Walwyn and the efforts that she put into not only developing this presentation, but really kind of putting together this webinar. Thanks, Danielle. And over to you, Latifa.
Thank you so much for your presentation, Maisha, and many thanks to Danielle for putting this together. I want to remind our audience to use our chat box to place your comments, and also use our question and answer box, and our panelists will get to you after. The webinar will be recorded and be on our website and our YouTube channel within the next few days. And now we are going to hear from the wonderful Miss Kaj Asha from the Bahamas. Take it away, Kaj.
Hello, everyone. It is a pleasure to present to you today on conflict of interest and the Bahamas' Health Promotion and Wellness Act. So the Health Promotion and Wellness Act is a landmark legislative document for the Bahamas that seeks to promote healthy lifestyles and wellness and to empower the adoption of national, regional, and global public health policies to reduce the incidence of non-communicable diseases and premature death linked to unhealthy food consumption and lifestyle behaviors. Next slide. Okay, so if you would like to have a more fulsome read of the Act or perhaps follow along during the presentation, you can scan this QR code here, which will take you directly to the Act itself. Next slide, please. So, a bit of context on how we got here. Before the bill became an act, it progressed through several key phases. In phase 1, work on the bill began in 2018 with foundational research, jurisdictional scanning, and the preparation of a preliminary layperson's draft of a health promoting bill. In phase 2, it gained significant momentum during a PAHO regional workshop on legislation and legal drafting of regulatory tools for industrially produced trans fatty acids, that's ITFAs, their elimination, as well as sodium target implementation in packaged foods, which was held in Bridgetown, Barbados in 2024. The workshop provided technical guidance on legislative approaches to eliminating ITFAs and establishing sodium reduction targets in packaged foods, which helped refine the policy direction. Next slide, please. So, the Health Promotion and Wellness Act does speak to conflict of interest. Specifically, Section 19 of the Act prohibits any person whose business, service, product, practice, policy, objective is to be regulated by the Act, among other relevant persons, from participating in policy decision-making and development of standards or any related matter governed by the Act. And the purpose of Section 19 is to safeguard the integrity and objectivity of public health policy development by addressing potential conflicts of interest, by prohibiting individuals or entities whose businesses, activities, products, services, or practices are subject to regulation under the Act from participating in policy decision-making or the development of standards the Act seeks to prevent undue influence from vested commercial interests. So this provision is intended to ensure that the policies, regulations, and standards established under the Act are guided primarily by public health priorities and evidence rather than by financial or industry-driven considerations. And in doing so, it promotes transparency, accountability, and trust in the governance of health promotion initiatives while reducing the risk of conflict of interest and compromise by stakeholders who stand to benefit from weaker or less effective public health measures. And so the bill, during the process of drafting the bill itself, we figured that there would be some pushback from persons within the food industry, as well as, the beverage industry. We figured we would get significant pushback from them. And so in phase 4 of the bill, we actually did undergo a stakeholder consultation, and we did include industry in these conversations, right? And there was a lot of discussion around, what should be regulated, what should be included within the Act itself, what should be taken out. And so we decided to have industry at the table because, we often have the conversation about whether or not they should be involved. However, our approach was to invite them after a draft that we were comfortable sharing was created. And that meant that industry could not influence the drafting of the bill, but rather only provide input on what was already developed. And so that was the approach that we took. We also figured that there might be some contention from the public with the bill in terms of food regulations. And so the bill evolved considerably over the drafting process. And we did include the public in those stakeholder consultations as well. And the principal bill itself was framed around broader themes of health promotion and wellness, including the establishment of a National Nutrition Commission. And at the same time, we have Section 9 of the Act, which grants the Minister of Health and Wellness the authority to adopt and implement national, regional, and global public health policies that address the banning or limiting of specific food products that may harm human health, as well as the imposition of limits on particular nutrient content in foods, warning and labeling requirements for ultra-processed products and foods containing excessive levels of nutrients of public health concern. So that would be your ITFAs, your sodium, your excess sugar. And it also speaks to the introduction of fiscal measures targeting companies that produce foods and beverages that adversely affect human health, right? So these provisions indirectly address issues such as ITFAs, excessive sodium, sugar-sweetened beverages. And of course, we have Section 20 of the Act as well, which authorizes the minister to implement regulations aimed at advancing health-enabling nutrition environments. Because we were thinking on a macro level, so changing the environments that contribute to these unhealthy food or UPP consumption, right? We wanted to create health promoting environments and encourage an overall sense of wellness within the Bahamas. And the intention was to use this act to do that. But back to conflicts of interest, we did, like I said, include Section 19, which specifically speaks to COI. And I did mention that we included industry in the stakeholder consultations. And like I said, this was not done until an iteration of the bill we felt comfortable sharing was provided to external stakeholders. And so commercial actors, they tend to employ a number of tactics when engaged in policy reform that we were very cognizant of. So they may be affected by the public health policy or legislation that we are discussing. And so one common approach that they utilize is lobbying for less stringent regulations, frequently framed around arguments related to economic impact, employment, or potential harm to business competitiveness. Industry representatives may also advocate for voluntary self-regulation or corporate responsibility initiatives as alternatives to legally binding standards, which can slow the adoption of enforceable measures, right? And another strategy involves challenging the scientific evidence underpinning proposed policies by funding research that emphasizes uncertainty or selectively presenting data to question the necessity of effectiveness of regulation. I know we've seen this with the tobacco industry, but it's also done by food and beverage companies and other corporate actors. So commercial entities may also attempt to shape the policy narrative through public relations campaigns that highlight consumer choice. They're saying the public should be able to choose what it is they want in their foods. And so this is a way that they kind of shape the narrative. They also look at personal responsibility or economic contributions, and they shift attention away from structural determinants of health, which is not what we want. So collectively, these tactics can dilute policy proposals, delay decision-making, or redirect reforms in ways that prioritize commercial considerations over public health objectives. Next slide. And that is it. Thank you so much for paying attention to my presentation.
Thank you so much for that presentation, Cash. It's just really exciting to hear about all of the work that is going on in Bahamas with regards to this policy development. Implementing this bill is definitely a significant win for NCD management. And now I will turn you back over to Alex.
All right, all right, all right. Wonderful presentations. Thank you, Maisha, and thank you, Kaj. We will now go to our panel discussion and question and answer segment. And the theme for this segment is our reality. Where do we go? Where do we need to go from here? So we have a beautiful set of panelists, beautiful not just in the work that they do, but also how they look. So I want to go ahead and introduce our panelists. Today, we have first Miss Janet Simon, and she's an educator and a part of the CARICOM Youth Ambassador, and she's also a part of Healthy Caribbean Youth, Antigua and Barbuda. Then we have Dr. Michelle Lashley. She is a pediatrician at the Queen Elizabeth Hospital in Barbados. We also have Miss Keely Holder. She's an agri-food system specialist in Barbados. And we have Miss Shana Small. She is a staff reporter at the Jamaica Gleaner. So for our panel today, we're going to be discussing the ongoing challenges in addressing childhood obesity across the Caribbean and to explore multifaceted interventions that have been employed across the region to address childhood obesity and innovative strategies that can be considered. So our first question will go to Dr. Michelle Ashley. Why should obesity be on CARICOM's priority list? So as a pediatrician who is involved in the call to action 5 years ago, how would you describe where we are today?
Thank you very much, Alex, for that your introduction. And it is really a pleasure to be here and to see how many persons from across the region are still interested in what is happening and going forward. Also want to specifically welcome and many of my pediatric colleagues that I've seen on so far, and I'm glad that we are still trying to hold forth going forward. So 5 years ago, we wanted to raise our voices. And you previously heard that video, the call to action. And today I would say we're in a place where we are greater aware. We have lots more evidence from across the region, but we are still on the verge of that explosion of NCDs in the near future that will affect not only the adults going forward, but the children and adolescents are already starting to show these effects. Childhood obesity is now clearly recognized that it's no longer an individual issue. It's not a child issue or a parent issue. It's a system or a national issue. And then we focused so far, because we know this, we're looking at better data. We have stronger and better regional and national policy conversations, which have been in alignment now with the greater NCD and climate change agendas that we have all been hearing about. However, a lot of this has not translated into real, consistent, and protective environments for our children. And this still remains a challenge in the Caribbean. But not only that some places have done really well, but it's still uneven action. We heard about many policies in some of the Caribbean countries earlier, but as you were listening, you would have heard that there was an absence of many, many countries in the Caribbean basin that still are not on board. And obesity is not a Barbados, Trinidad, and Bahamas problem. It is a Caribbean problem or worldwide problem. We know that across the region, we have been documenting, and the latest data says up to 3 million children in our region are overweight, and that is staggering data. And we don't have to think twice about it. Very recently here in Barbados, in a soon-to-be-published study, we identified within our primary school environment the prevalence in both the younger children, this is the 6 to 9s, as well as the older ones, which is the 10 to 11 group, had increased by at least 10 percentage points in the last known published data. That is scary. We thought we
It
were doing
is.
well. We're doing worse than we were doing
Yes,
before. So what are our challenges? Persistently, we have lots and lots of policies on the making, but there is policy to legislation inertia. In other words, we have a lot of talk, but the do isn't really quite there yet. And in the
that's
last
right.
5 years, we have seen many commitments, but very little implementation across the board. Children are still besieged, and I love the word besieged because it makes you feel like they're really bombarded, because that's what happens with aggressive marketing of these ultra processed foods, even within some school environments, at sports events, in their daily and social media that they're exposed to every day. And these should be the spaces that protect their children. These should be, the primary spaces that they are every day. They should be more protective than giving them all of this poor information. Even with the families, their parents and adults have difficulty navigating this food environment we're living in. When you go to the
Yes.
supermarket, you're not even sure what you're picking up off the shelf. And on top of that, because we are small island developing states, the Caribbean is one of the regions where the cost of a healthy diet is some among the highest in the world. We're not producing a lot of the cheaper foods that parents could look for. At least they don't know how to look for these yet. So what's left? Nutrient poor, energy dense foods that are only affordable to most people. We also are limited now by physical activity challenges. Few safe play spaces within many communities, particularly in the urban areas. And then environments even within schools that are not supporting movement play because PE regulations are not always implemented as they should be, particularly in the secondary school era. So before I close off my answer, I just want to say there's promise. Things always have to have a silver lining. Talked about all this
Yes.
stuff that seemed to have been horrible just now. But we have some good things that have happened in the last couple of years. And those give me some real hope that we have some stuff that we can go forward with. Early life interventions, breastfeeding support, and the baby-friendly hospital practices. These are high-impact, equity-promoting interventions, and I think we should really continue to promote these. We also have had, as you heard, a lot of policy wins. Despite them not being completely universal across the Caribbean, they are there. We have had Barbados and Jamaica now part of the WHO accelerated plan to stop obesity. We've had comprehensive school nutrition policies in at least three large islands within the Caribbean. And we've had the consumption tax on sugar sweetened beverages that I have confirmed it is at least 4 or 5 Caribbean islands so far. And then we have the Healthy Caribbean Coalition, biting my tongue on this, which helps us with accountability and utilizing the tools of the Caribbean Obesity Prevention Scorecard so we can see where we all are and how we can move forward as we attempt to make this a more equitable policy and intervention. Thank you.
Well, Dr. Lashley, we can truly say we have come a mighty long way, and we have still some ways to go. So we have Miss Janet Simon, who will now be speaking. She wears many hats as an educator, creative and youth leader, and advocate. From your vantage point, what are you seeing on the ground in Antigua and Barbuda, particularly when it comes to children's nutrition, physical activity, and overall well-being?
Okay, thank you for that question. For me, I've been an educator for just about 10 years now, and I have had the opportunity to see the grave effects that unhealthy eating has had on our children within our educational system here in Antigua and Barbuda. So first and foremost, I'll say that for us here in Antigua and Barbuda, physical education is a staple within our schools, especially our primary schools. It's a staple. Every week, like clockwork, our children are out at least once a week doing physical education. And especially when it comes to sports week and so forth, even more our children are engaged in that sort of activity. Furthermore, in the secondary schools, Many of them participate in track and field. So there are different activities that are available for children to keep themselves active. However, the challenge I would say that we have mostly is the unhealthy food environments within our communities and also around our environment. Now, here in Antigua, I would say that from my experience, I have seen children who prefer having fried chicken and a soda. First thing in the morning, they get to school. They haven't had anything else to eat for the morning, and they would prefer having some fried chicken and drinking some soda, and that is breakfast for them. Or break, they will have corn curls or a large brownie square. So it's a lot of ultra processed foods that are available to our children here in education, here in our schools. So I must say that we're trying to work towards addressing that, which I would cover further in my next question. However, I would say also that in addition to this, what we see is that we have organizations who are working tirelessly to ensure that they try to assist where they can. So, for example, the Diabetes Association here in Antigua and Barbuda, because we do have children within our school system who have type 1 diabetes. Now, the Diabetes Association, they make regular visits to the institutions, to the schools, to these children to ensure that they are doing exactly what it is they need to do. So children are learning to test their blood sugar, persons around them are being educated as to exactly what it is they need to do in the event that the child's blood sugar might drop, or, if they have high blood sugar, they're trying their best to work towards educating us as teachers and students. And I would say another thing would be that families are not communicating prior history of NCDs, especially when, diabetes is something that runs rampant in the family, high blood pressure. It's not being communicated. Children are not aware. So they see the processed food and they love it. They go for it. And from early ages, that's when we need to work with them to teach them, because that's when they're conditioned into a particular mindset. And we need to work towards targeting that. So through what we're working on the ground here, especially towards a school nutrition policy, we're working to try to address that through various policies.
Thank you. It's so hard, guys, for us to just be on the time because there's just so much information, but I'm asking our panelists to remember our time constraint. But at this time, Miss Small will be sharing with us from a media perspective, how can storytelling, journalism, and creative content help shift norms around food, movement, and health for children and families? And can you reference the CBD awards and impacts of the increased media coverage?
Okay, so thank you, Alex, and thank you so much for inviting me to be a part of this very important webinar. So we know that one of the functions of media in society is to drive social change, and this is especially critical when it comes to health journalism. As journalists, we know that stories are at the heart of human existence. We're basically hardwired to respond to them. So in reporting, it is important that the news pieces, that the articles that we produce are in alignment with the experiences of our varied audiences. Audience consideration is critical in storytelling. Rather than just simply presenting the issue, people need to see themselves in it, to be able to relate to it. And so therefore they will be more responsive to the message and to effect change. We also need to consider where children are and their families are getting their news. We know that interest in news is declining. The most recent study from Reuters showed that less than half of the world's population is interested in news. And we all can guess, the demographic that is the least interested in news. It is our young people. So how do we bring the message to them, to their preferred platform? We know that they are using a lot of social media, TikTok, Instagram, and so forth. So it is in the best interest of the media, mainstream media especially, to create content that is attractive, free of the technical jargon, and bring it to where our youth, our young people are. Now, journalism involves getting the experts, the people who can explain the issue, and these are people like social and behavioral change professionals, health researchers, health communication professionals. And when we do this with the content that we produce, we are creating trust. At the same time, we're also reducing misinformation. And these experts are also critical in analyzing and exposing potential gaps in our policies. So we've mentioned it before on the webinar where recently the Jamaican government announced a special tax on non-alcoholic sugar beverages. And while it has been commended a lot for this move, there's also been some conversations as to whether or not this may be effective. So this is where effective in curbing non-communicable diseases. So this is where we would get the experts to come in and to analyze and may possibly end up influencing our policymakers to recalibrate and so forth. There's also a stick-to-itiveness that journalism requires. Staying on an issue can increase the impact. You mentioned earlier the national food policy in Jamaica, and that effort to implement the national school nutrition policy has been ongoing for a number of years, and it was only until last year when it was actually moved to the white paper stage, meaning that there is no laid out policy and the government has strong intention to implement it. So journalism, we had the support of journalism requires support of advocates and researchers and so forth, but it is this change that we're seeing with the sugar tax and also the national school nutrition policy. I would say it's because of the consistent reporting that we as journalists in Jamaica have been doing on the issue. So media has a critical role to play in shifting health norms. But in doing so, it is important that we share culturally relevant stories. We try to get to the audience where they are, and more importantly, we interrogate policies to ensure that they're beneficial to everyone.
Thank you very much, Ms. Small, for sharing. Now we have some community-based solutions, and these will be shared by Maisha Hutton. Maisha?
Thanks, Alex. Again, I want to compliment Danielle. These are her slides. So childhood obesity prevention and related advocacy efforts have been powered by people. Civil society organizations, youth advocates, educators, and ministries are working together to build a movement rooted in participation, innovation, and bold advocacy. So here's a snippet of some of those activities. CSOs have been empowering youth, not just future leaders, leaders now. Caribbean CSOs are not simply creating platforms for young people, they are investing in them as current and future leaders in the NCD response. In St. Kitts and Nevis, Lake Health and Wellbeing hosted a youth health policy dialogue in December, building on previous engagements that created space for students to have frank solution-oriented conversations about health and well-being. People-powered movements are also fueled by creativity. In Antigua and Barbuda, Arthur, the mascot of the Heart and Stroke Foundation of Antigua and Barbuda, brings heart health messages directly to students, transforming prevention education into something relatable and memorable. Back in St. Kitts and Nevis, Lake Health and Wellbeing developed the My Healthy Heroes series, creative cartoon characters that promote healthy eating and physical activity in child-friendly ways. The Grenada Food and Nutrition Council has created opportunities for youth creativity through competitions that challenge youth to design solutions and messaging that reflects their realities. These initiatives demonstrate that childhood obesity prevention is not only about restriction, it's about imagination, culture, and engagement. People-powered movements also show up in collective advocacy for stronger policy environments. In Antigua and Barbuda, the Sweet Talk campaign, implemented in collaboration with the Ministry of Health and Wellness, mobilized public awareness and culminated in a joint social media campaign with Lake Health and Wellbeing, reinforcing regional solidarity. The Heart Foundation of Jamaica has also been active in policy advocacy, supporting healthier food environments. The Jamaica Youth Advocacy Network has been critical in ensuring that youth voices are centralized in the school nutrition policy development and implementation processes. And civil society and youth from Barbados, Belize, Jamaica, St. Lucia, and the Bahamas have participated in a front-of-package warning label demonstrations, making visible the demand for transparent, evidence-based nutrition policy across the region. Regional actors are reinforcing this momentum. Rotary International District 730 continues to create spaces that normalize healthy eating and physical activity, contributing to a culture shift that supports prevention beyond classrooms and clinics. This is from an initiative called Hope for the Future, where young people from across the region came together around childhood obesity prevention, focusing on school nutrition policies, really signaling the power of youth and communities working together. They worked not only leading these initiatives, but worked with partners in ministries of health and other key stakeholder communities. So what's the bigger story? Childhood obesity prevention advocacy in the Caribbean is people-powered. We salute all stakeholders who have been pushing for effective and evidence-driven action to tackle childhood obesity. Thank you, Alex. Back to you.
Thank you very much, Maisha, for sharing this. Now, Ms. Keely Holder, our agro-food systems specialist. We keep on forgetting agriculture. And the Lancet series on ultra-processed foods highlights how pricing, marketing, and supply chain shape consumption. From your perspective, what system-level shifts are most urgent in the Caribbean to reverse our reliance on ultra-processed foods and make healthy choices the easier, more affordable option for families?
Thank you, Alex. First of all, I'd like to start by explaining that when we look at 60 years of long-term food and agricultural data, we've seen that the structure of our agri-food systems have been changing, and this has been due to a dietary transformation that's been taking place. We know that consumption has been increasing and our diets have been deteriorating. And these shifts in food habits are actually resulting in an alarming consumption of sweets and sugars that are 2 and 3 times above the goal intake of the WHO goal intake. And we're seeing a similar trend for oil and fats. And I'm singling those out particularly for a specific reason. Additionally, the data that we have for 9 Caribbean countries also reveal that the cost of a calorie-sufficient diet as a share of average food expenditure is 20% or less. However, when it comes to a nutrient-adequate diet, it is 2 to 5 times more expensive to be adequately nourished, and the cost of a healthy diet is double that at 34 to 57% more of the food expenditure for a healthy diet. And I also want to explain that this is a consistent trend globally, where obviously the cost of a calorie sufficient diet is going to be cheaper than a healthy diet. But of course, because of our challenges as very small islands, the Caribbean islands tend to rank within the top 40 highest cost of a healthy diet grouping. We would tend to rank within that space. Additionally, I also want to say that we are seeing going on from what Yuri showed in terms of sales of UPF, we are seeing between the years 2017 to 2023 increasing rates in sales of UPFs of 4 to 13% per annum for the 8 Caribbean countries that we did look at. So those trends are consistent. Now, what is driving this at a macro level long term is that incomes per capita in particular results in, well, the share of the food and budget expenditures will fall with higher incomes. There's also this deep hardwired desire for diversity in the diet. And other things that are shaping this would be the structural transformation of the economy, but also particularly westernization. And this westernization, if we want to drill down a little bit more specifically, we're talking about the diffusion of modern food retailing, which is driven by major consumer brands that have tremendous marketing power. And these are the companies that are behind the ultra-processed foods, and they are creating this they're overly influenced in consumer buying choices. Now, our policies or lack thereof create a problem. And so the solutions that we need to look at, first of all, is to start to develop an integrated policy framework. And I'm really happy to see what the Bahamas has started to do. But our policy framework needs to have 4 components to it. It needs to have policies related to food availability and food access. And so we're talking about agriculture and socioeconomic policies. Our trade and tariff policies also need to be in alignment with our public health policies. And then the public-private partnerships on health and wellness also need to be in place to have that coherency. In terms of our food availability and food access, the key thing that we need to start to define is what is the set of priority healthy foods. So we talk about making healthy foods more affordable, but we need to have a priority because a lot of foods are healthy, but in the specific context where we're having high consumptions of sugars and high consumptions of fats and oils, then our priority foods need to focus, of course, on whole foods that are minimally processed foods, appropriate serving sizes, but also we want to make sure that they're focused on countering sweets and sugar. So we want to recommend low carbohydrate, high fiber vegetables, low carbohydrate, high fiber fruits, complex carbohydrates and starch, no calorie or low calorie beverages. And then in terms of the excess consumption of oils and fats, we want to counter with the higher consumption of omega-3 fats. In terms of our socioeconomic policy, there are policies that we can look at, and I know some countries have started looking at zero rating or subsidizing these particular foods to reduce their costs, but also incentivizing the agri-food sector to preferentially and efficiently produce these foods in the package size, the recommended serving size that we're looking at. And a key aspect of this when we talk about healthy foods and making them more affordable is looking at programs like the Supplemental Nutrition Assistance Program, where you are going to procure a local supply of these foods, and you want to be able to provide them for the least to the most vulnerable in the society. So where there are welfare programs, as opposed to just offering persons a check, maybe you offer them $50 or $100 worth of these types of foods so that you ensure that they're getting them on a weekly or a monthly basis. And our trade policy as well, it needs to align with these policies where, yes, you're protecting local healthy foods, but also you want to see where you could increase the tariffs on the categories of unhealthy foods. And our public policy, we've been doing a fantastic job so far with that, and we have seen some of the key things, but one of the key areas where we want to move into is education and intense food and nutrition education and awareness programming, because this is the feedback loop between retailing strategies and consumer buying. So as consumers become more educated, they make different choices and our retailers have to respond. And we are already seeing that with big companies like Kellogg's shifting behavior, and that's a big win for us. Additionally, on our regulation, we've already had taxation, but other things to look at, restricting of marketing of unhealthy foods, particularly to children. Having that food marketing legislation, I think, is a key area that we also need to address. And finally, in terms of our partnership, we want to develop a national health and wellness inclusive business strategy that speaks to the same industry actors on how can we assist them in terms of their international procurement and retailing specialists to help them with being able to source more affordable and pleasing foods for our Caribbean people. Thank you.
Wow. Wow. I don't know what to say after that. I think you hit almost every single area. I don't even want to start because as an advocate, as a dietitian, I don't even want to go down that road because we're going to be here until late. So working with the time, we have Dr. Lashley again, coming another heavy hitter. Dr. Lashley is well versed in her area, and she is very confident to speak on the different areas. Are there shifts, Dr. Lashley, that needs to occur within the healthcare system to better support the prevention and management of childhood obesity? Can you reference shifts that have been made, including improvements in breastfeeding supports and our baby-friendly initiatives within our hospitals?
Thanks very much, Alex, again. I'm mindful of our time too. This is going to be very brief because we could talk about this for quite a long time. But one of the things that we have to understand is our healthcare system was based on a different kind of model that we need to adapt now. Previously we had sought to establish care for patients or treatment. But I think to be able to handle this, we have to look at a new model based on prevention and advocacy, even within our healthcare persons. So just to address quickly, advocacy beyond our clinics. We have to be able to take our information to schools, to planners, to policymakers, but we have to be able to help them to understand how they need to adapt and reinvent these new environments that we are living in. We need to be able to help them to embed nutrition within our daily practice management. In other words, nutrition and weight management should not be a standalone issue. They should be embedded and integrated in every primary care encounter that our healthcare officers have, and not just doctors, but other healthcare professionals as well. And we also need to think about maternal health services as being an integral part of managing nutrition, because it is the mothers and the mother's health and the preconceptional health that is actually just as important as the child's health. And then some kind of comprehensive care where we should be thinking more on family-based and multi-component lifestyle management services. We're now thinking about movement as a prescription, not only just the drugs, but also thinking about physical activity as part of our prescriptive type healthcare services we need to offer. And ultimately, we don't want to blame the children. The children themselves cannot outrun this epidemic. They can't out-educate it. They can't unchoose their healthy environments. We, as the healthcare professionals, have to help them to go forward. And the evidence is clear. It's urgent, and we need the courage to move forward and to identify the policies that need to be pushed with the advocacy from the general population. Thank you.
Boy, Dr. Lashley, you're speaking my language. I am in agreement 100% with what you said today. Now, lastly, but not least, Miss Janet Simon, in a recent co-ed, you've spoken about the power of policy to shape healthier environments. What specific policy actions do you believe would make the greatest difference for children right now, particularly in school and community settings?
So for me, hearing into you currently, I must say that we have been doing quite a lot as it relates to, shifting the narrative where nutrition is concerned for our children. Now, Antigua would have attained baby-friendly status in 2023. Now we have a cabinet approval where it regards the infant and young child feeding policy, where for children under the age of 5, we're focusing on ensuring that babies are, fed in accordance to nutritional guidelines. Now, in addition to this, we are working towards ensuring, well, not working towards, but we have community nutritionists on the ground offering counseling to our children as they come in, well, children and adults. But one thing I have been able to identify is that they have been seeing rising numbers of young children coming in, which they would have to offer counseling to as it relates to these children being obese. Now, we haven't finalized as yet our SSB legislation. However, through this initiative, sugar sweetened beverage tax, We are ensuring or working towards targeting schools to ensure that these sugar sweetened beverages are not being sold in and around our school compounds for children to so easily access. So we're working towards that, and the tax that would be gained from this initiative would go towards a public health campaign. Now, further, we
Janet, I think she got disconnected. Are you guys hearing her, panelist?
No.
No, okay.
No.
All right. All right. Unfortunately, Jeanette got cut off, but oh no, the internet gives trouble. We know this. So let us move into our question and answer segment. Oh my, the questions are coming in. I thought it was one question, but we have quite a few questions. So I'm going to invite at this time for Kaj, Prof, and for Maisha to join us here on our panel stage. Here we are virtually on a stage. So I'm going to invite Kaj and Maisha and Prof to join, Professor Steele to join us. Wonderful, wonderful. All right, so the first question is coming in from Imogen Sharp. I'm going to throw this question to Keely and to Professor Steele.
good evening.
Yes, Jeanette, you got disconnected. Would you like to
Unfortunately,
finish your statement?
please, if I may have the opportunity to.
Yes.
Okay, awesome. So I was saying that we're in the early stages of the school nutrition policy. We're working towards getting background information so that we can appropriately inform the decisions that we would make as it regards to this policy. Definitely, once we're able to pass the sugar sweetened beverage legislation, we're working to ensure that this is indeed incorporated into the school nutrition policy. One thing they would have noted so far is that many schools on island, they unfortunately do not have paraphernalia that supports healthy eating, and that is something that most definitely needs to be addressed here. And also, we have a school a school meals policy here in Antigua, specifically for our primary schools. And I believe with the introduction of the nutrition policy, this too would be taken into consideration. So we're definitely working towards trying to ensure that we shift the narrative for our youth here in Antigua and Barbuda, ensuring that they are offered healthier options, healthier alternatives, so that, we always say our children are the future. So we're trying to ensure that we really, match what it is that we're saying here.
Our children are really the future. Thank you very much, Janet. And we're happy that you got to come back on and finish your statement. So the question is over to Prof. Steele and to Keely Holder. I'm interested in the relative proportion of imported foods and beverages versus domestically produced food and beverages, and how this might potentially influence policy on UPFs. I'm throwing the question out to Keely and Prof. Steele, but any of our panelists or presenters are free to respond also.
Okay, I'll jump in here. First of all, because we are islands with very limited commodities, as you guys know, we have a significant food import bill. When I have disaggregated the bill for Barbados, and I'm sure that the data is pretty similar, processed foods account for about 50% of our food import bill. Okay, and we have very little manufacturing here relative to the consumption patterns. So, in terms of agricultural supply, agriculture accounted for about 25-30% of the food import bill for Barbados. I'm certain CARICOM probably has numbers that we can disaggregate some more. And one of the key things that comes out, like if you're looking at packaged foods, Caribbean foods will have sugar as an ingredient versus American foods that will have high fructose corn syrup. So like that's a big one that will stand out there in terms of imported versus domestic. And
Yes.
so that's critically important for us. So even if it's a processed food, we're not getting this huge amount of high fructose corn syrup. But because we import such a significant amount of our food, and generally within the region, about when we do an assessment of where food is coming from for us, about 50% of our food or our food supply that is imported comes from the USA, and about 25% or so will come from Europe. And so this is interesting because from in the European side, because they have stricter rules on ultra processed foods, then you could
Yes.
get the same food, but it's actually different ingredients. And so where that choice could be made, or where we could encourage the importers to source more from Europe, that could actually be useful for us. So things like that are important in terms of influencing the policy. And that's why I talk about the private-public partnership, where we talk to them about where they're procuring from. Because if we can't control it because we don't manufacture it, then we could at least guide them to procure from places which have better rules. So if it's coming from Chile, it already has front of package labeling, so we don't even have to advocate for it because it's on there. So things like that could be useful for us.
I agree. Thank you very much, Keely. We really need to take our food imports, exports. We need to look at growing more of what we eat, and to the point that we can export and all of that. So it's truly a discussion. As I always say, we keep on forgetting agriculture. We're not remembering that agriculture has a very big role to play in all of this. So just the last question for tonight. Unfortunately, we are running against the time, but Colin Alert asked this question, and I think it's a very good question. All the questions were excellent, but I'm going to throw this out to Dr. Lashley first and allow, for others to come in. So do our ministries of health and wellness realize that we need to redirect the direction of our health services, which is focused almost exclusively on treating diseases rather than disease prevention? Dr. Lashley, hurry up and answer so I don't have to talk, because I don't want to take up the time.
Thanks, Alex. I mean, this is
Yes.
exactly what I was talking about.
Yes.
We really have to consider not just at the ministries, though, Dr. Alert, but we also want to think about our personal practices, because we have to direct ourselves too. And we can't wait for the ministries to realize that we have to do more preventative care, because their focus has very small silos. And yes, they do focus to some extent on prevention, but they may not always look at the big picture because they may not see the clients in the same way we do. We do need to advocate, and the only way ministries of any kind of health, wellness, or however else we want to describe them will understand what is going on is if the doctors say it to them. And not even say the doctors, because we need to come together as a body to be able to say these things. And my advocacy here really is our medical associations across the Caribbean, the Barbados Association of Medical Practitioners, the TT Association, the Bahamas Association, Jamaica groups. We as a Caribbean organizations really need to speak out and advocate more. And I think they do know, but they are not always in the position to be able to direct it as they should, because they may not have the backing of the people who are right on the forefront, talking to the patients day to day.
And just to add, Dr. Lashley, we need more nutrition and dietetics clinicians in our spaces to assist our doctors in educating patients. We need more physical therapists in primary care. We need our all our specialist groups. We need more social workers to assist with social workers and psychologists to assist with the whole behavioral change issues. So it's really a team approach. It's a multidisciplinary approach. And I know we can do it. We just need to put our efforts in the right position, in the right place, and get the ball rolling. But we have strong clinicians over there in Barbados like you, who are championing the cause, and Dr. Alert also, who is working to push for a healthier Caribbean. So
I must say so. Alex, let me have a little push to put in here for Dr. Alert. He is one of the main advocates. He writes in the newspaper to try and get people to be able to understand the whole process that's happening. So I know he's asking this, but I think he's doing a wonderful job as it is to at least to educate a larger majority of those who actually read the news, Miss Small.
Yes.
So I know you spoke about that earlier, but for those that do read, we are trying to push that from the educational point of view, and quite agree.
Well, Dr. Alert in Jamaica, we say big up yourself. So we're bigging you up very special this evening. So the last final question. I'm telling you, this has been so good. I am enjoying myself. The last question to our panelists and our presenters. Why should childhood obesity be on the CARICOM's priority list? Now, I want this to be a final popcorn. I just want you to give me a 30-second pop in response. Why should childhood obesity be on the CARICOM's priority list? Who want to jump in first?
Maybe I'll kick it off really quickly so I can wrap up. Just to say that we know, I mean, the data is out there. It's clear that addressing unhealthy diets above tobacco use, alcohol use, above the risk factors is one of the single greatest tools to address obesity and diet-related NCDs. So if we can tackle obesity, especially obesity amongst children, we will go a long way towards preventing those NCDs, which are really crippling our region right now.
I'll jump in. I'll say that childhood obesity strongly predicts adult obesity and chronic related conditions. And this is why I think it's so important to tackle it.
Awesome, awesome. Kaj, you want to jump in here?
Sure. So I'll just say that, addressing obesity, particularly childhood obesity, should be a priority because we know that behaviors in childhood can carry on into adulthood. And so if we address this now at an early stage, we can reduce, healthcare costs in the future, and we can have healthier populations in the Caribbean and the region of the Americas.
Awesome. Janet.
Hi, well, for me as a CARICOM ambassador, I believe strongly that CARICOM should really work towards making this a priority because, as I said earlier, we are looking at our youth as an investment in our future as a Caribbean region. And if truly we're to look to our young people to be able to carry on what it is we're doing now of today, we have to ensure that straight across the board, we are working together to ensure that they are provided for, that they are cared for, and they understand what it means to live a healthy lifestyle.
Awesome. Miss Sashana.
Yes, so I believe that CARICOM government should make it a priority, as was just said here in this webinar. We're facing a crisis, and the youth are our future, and it is critical that we try to address these issues as early as we can, because as explained by Ms. Archer earlier, when we have these kinds of behaviors in our childhood, it mirrors what we do in adulthood. And our rate of NCDs in the Caribbean is just too high. So we need to tackle it as soon, as quickly as we can.
Healy, and then Dr. Lashley will close us off.
Yes, I would say that we know that childhood obesity once it's acquired by adolescent age, is a major risk factor for NCDs. We have lower fertility rates, and in terms of the workforce, you're talking about people who are sicker earlier in the workforce. So not only are they our future, but they're also our future earners, and that will put immense pressure on not only our healthcare system, but on our workforce and our country's productivity. So there are a huge amount of reasons why it needs to be a priority for the Caribbean.
Thank you. And Dr. Lashley.
So to make it short and sweet, childhood obesity is not a personal failure, it's a society failure. We have evidence, we have all the solutions, and I think my word is we need to now have the collective and the will to act on it.
Wow. Wow. And like I always like to end anything I do as a nutrition professional, let your food be your medicine and your medicine be your food. I think it answers so many questions. So I'll now hand over to my co-host, Miss Latifa Holder, and thank you all. Thanks to our panelists, and thank you all for tolerating me as your moderator. Latifa.
Thank you so much, Alex. What an invigorating conversation. It really is exciting to hear about the policy developments that is happening in our different Caribbean countries. There's certainly a lot more work that needs to be done, but we have made significant strides in tackling NCDs across the Caribbean. I would like to thank all of our presenters, our panelists, and to you, our very engaging audience, for making this webinar a success. The question is no longer what needs to be done, but whether we are ready to act with urgency for our children. Half of the global population, 4 million people, are expected to be living with overweight and obesity by 2035 if we don't act now. I am Latifa Hola from Healthy Caribbean Youth, thanking you for joining us in this webinar. Have a good night.